To the CAER Living Well webinar. Really fantastic agenda here this evening. I'll be handing over to Mark shortly. We're expecting a really significant level of attendance tonight, well in excess of 100, we think. Thank you all so much for coming already. We're just going to allow everybody a couple of minutes to join before we start off with what is a really packed agenda this evening. And I'll hand over to Mark as we just wait for people to come into the room.
Brilliant. Thanks so much, Christian. The first item on the agenda is to lay out our strategy for 2022. And I've just got to say it's such an incredible privilege and a huge responsibility, I think, to just try and describe the amazing things that have happened over the last a couple of years and the phenomenal opportunity that exists for us to transform services for children and young people across the district, across the our country. These opportunities really are once in a lifetime, and it's just such an exciting time for us all to come together to talk about how we can really transform provision for children and young people. So yeah, can't wait to start and hear from all of our different stakeholders across the group. So what we'll do is we'll just wait a couple of minutes just to allow everybody to join. I think we actually had over a couple of hundred people registered, so it'll take some time for Zoom just to allow everybody in. So we'll wait till 5 past the hour when we'll start. Christian, any thoughts from you before we kick off?
No, I'm just I'm so excited about what lies in front of us. It's the first time we've been holding these webinars for, well, this is into our 3rd year of them. And they've been a really remarkable meeting place for people from health, from the higher education research community, from the local council, and of course from schools. And we've been overwhelmed by the level of attendance that we've had so far this year, and this is the biggest event so far. I think it's a time today when we are properly in a position where we can pivot this city and the system as a whole in Bradford away from COVID response properly into the space of COVID recovery. This is the start of the marathon effort, the joined up team effort, as we progress together as the city, as a system, to dealing with the problems that were there all along, which have been laid bare by the impact of the pandemic. But here starts our new future. I'm really excited to be part of that.
I couldn't agree more, Christian, and what a testament to the desire across the whole our system to really create genuine change. So it's just fantastic to have colleagues from central government, from our regional universities, of course, our brilliant schools our system, but our paediatricians, everybody coming together on this call to talk about how we can work in genuine partnership to make a real difference. So I think we're coming up to 5 minutes past. I'm sure we'll have people joining us late, but let's start proceedings. So the first item on today's agenda is the outlining of the CARE strategy for 2022. So the Centre for Applied Education Research was created through the Department for Education's opportunity area. It recognised that children and young people are being served incredibly well by schools, but that we often have a disconnect between our school system, our health system, our social care systems, our regional universities. And CARE was an effort to bring everybody together, get everybody around the table to say, how can we work in partnership to support our incredible schools, our incredible educational establishments, in order that we can reach every child and young person and give every child and young person the best possible start in life. And we just know there's a desperate need for us to make really phenomenal changes in the our system. The tragic case of Star Hobson really revealed how many of our systems are just not fit for purpose, about our limited ability to share critical information. And our CARE community contributed towards the Child of the North report that was published at the end of last year. And that report is devastating. The report shows how many of our children are being subjected to criminal exploitation, sexual exploitation, how many of our children are suffering from food insecurity, how many of our children are facing barriers to their education, and what limited social mobility some of our most disadvantaged communities experience. And it's just time for us to say this is not acceptable. And this is our opportunity to see how we can all work together to just consign these terrible statistics to the history books. So we must start tackling the fundamental issues that are creating these difficulties. And by any analysis, the biggest problem that we face is the fragmentation across our different systems. The fact that we have health systems, education systems, social care systems, policing sort of systems, university sort of systems that are not connected. And the point about the Centre for Applied Education Research is that it gives us the opportunity to start connecting together, to start working in genuine partnership in order to allow multi-agency responses to protect children and give them the very best possible start in life. And that is the mission of the Centre for Applied Education Research, to allow a holistic whole system approach to supporting children and young people, using the resources, the capacity that already exists, using the information that describes children's lives, that resides on different systems throughout our various organizations, and bringing that information together so we can put evidence at the heart of policy making, so we can use connected data sets to really understand localities, to understand families and communities, and use that knowledge to drive forward innovative approaches to tackling barriers to education, to tackling upstream determinants of physical health and mental health, and ultimately allowing every child and young person to have the very, very best possible start in life so they can enjoy social mobility. And at the heart of CAER is the recognition that educational settings are incredibly important within this ecosystem. We need to bring every part of the ecosystem together, but schools are trusted organizations within our communities. Schools are the locations where children and young people spend a disproportionate amount of their time. And schools have got to be properly supported in the incredible work that they're doing to help our children and young people meet the challenges of life. So our fundamental principle is to bring everybody together around our school settings in order that we can provide the very best possible support, the very best possible sort of services to the next generation. And our work is being driven through the insights that we're obtaining from the Born in Bradford longitudinal birth cohort study. So BIB, Born in Bradford, has been following the lives of 13,818 children, following the mothers through pregnancy, following the children through birth, and now following the children as they grow up. And what that has allowed is for us to start seeing how different aspects of a child's life intersect and interact to ultimately determine outcomes. And what the data allow us to do is start exploring how we can better connect our different systems, how we can trial innovative approaches to helping support children's lives. And off the back of Born in Bradford, we managed to create the Connected Bradford dataset. So called DEEP has an incredible work in getting the permissions in place for us to bring together the routine data, educational records, medical records, social care records across our whole district in order for us to start understanding and exploring innovative approaches to giving better services to our children and young people. So we have started to put together the tools that allow us to make real progress. And the Connected Bradford dataset is now underpinning the next phase of Born in Bradford, Age of Wonder, where the cohort's being expanded to 30,000 young people and following those children through their secondary school experiences, the world's largest and arguably most important study of adolescence. And it's here on our doorstep. We have the ability to really make a difference, to understand what it is that we can do to really tackle those endemic problems that we talked about earlier. And what these connected data sets are allowing us to do is start exploring new methodologies, new approaches that offer hope to our district and hope to our country. And what our connected data sets are allowing us to do is start properly describing localities, start to understand the different contexts faced by different communities, recognizing that solutions in one part of our city, of our district, will need to be tailored if it's to be effective in a different part of our district, in a different part of our city. And by bringing our connected data sets to describe these areas, we can start properly contextualizing interventions, and we can start to connect up schools with health systems, with social care systems, with policing sort of systems, so we can get that whole system multi-agency response. And the opportunity area funded by the Department for Education is now transitioning across the Bradford district to become the Alliance for Life Chances Partnership. And the partnership is going to start taking a place-based working approach where we will set up different community partnerships in our different localities and empowering our communities to start engaging with policymakers to make sure that the services and the solutions that we're exploring are right for them, that fit with their contextual needs. And what this is allowing us to do is start tackling inequalities at their root. So I live in Wharfdale on the left-hand side of the top graph, and I work in Manningham on the right-hand side of the graph. Is a 10-mile cycle. And that 10 miles equates to 10 years difference in life expectancy. So the children growing up in the part of the world I live in are expected to live 10 years longer than the children growing up in the area that I spend most of my working life, in the Bradford Royal Infirmary. And we know that we're being blighted by these health inequalities. But importantly, health inequalities do not operate in isolation. If we look at the opportunities available to children growing up in Manningham, we see that the vulnerabilities multiply. And this is why we've got to start taking a place-based approach, using our connected data sets to start understanding how health, education, social care, transport systems, housing are intersecting and interacting to create these problems, so that we can then tackle these problems at their roots and eradicate them for once and for all. And this is the methodology that we're going to pursue rigorously over 2022. And we believe that we have the tools and the infrastructure that will allow us to start making real progress in this work. But we desperately need everybody to come together in order to support this whole system working. The whole of this approach is predicated on the belief that no single organization or no set of individuals can do this by themselves. This has got to be about co-producing solutions with communities. It's got to be about everybody across the whole system coming together. So whether you're within a university, or you're within a school, or you're within a health sort of setting, or you're within the local government or central government, we've got to come together to make these methodologies effective, to make these methodologies land. And as I say, we believe that we have the infrastructure that will allow that to happen over 2022 and beyond. Because as Christian said, this isn't a sprint, this is a marathon. Our children, young people have had 3 disrupted academic years. It will take decades for us to mitigate some of the consequences of the pandemic. And we need to start that work now. But we are blessed. We're blessed within West Yorkshire because we've got a phenomenal community, we've got incredible resources, and we are very, very fortunate that we have some core funding that will allow us to make this happen if everybody engages in this sort of a process. So we have this incredible school network. You can see the number of schools that are on this sort of call. We have world-class scientists. We have world-class academics across multiple sort of disciplines who want to get involved, who can bring their expertise to bear. And we have fantastic buy-in from across our whole system, from the CEO of our local authority to the CEO of our hospital and care trust, from our voluntary sector to our businesses. Across our district, everybody is willing to park their egos, park their organisational sort of barriers, and get on with the hard work of trying to make a difference, trying to tackle these wicked societal problems. We've got fantastic physical resources. We've got a brilliant building on the Bradford Royal Infirmary site, the Wolfson sort of building that houses the Centre for Applied Education Research. That is our building. Everybody on this call has access to that sort of a building. It's a building for us to come together. John Wright describes it as the train sort of station, the terminal, where we all come in and we interact with one another. We've already talked about the phenomenal data sets that we possess, data sets that are unique across the sort of world, data sets that really allow us to start understanding the problems that we're trying to tackle. And our desire is to start using that incredible data infrastructure to support other areas around the UK to be able to develop the type of sort of tools and type of approaches that we're adopting through the Centre for Applied Education Research. And then we're incredibly fortunate that we do have great relationships with our central government partners, from the Department for Education to DHSC through to Number 10. This gives us a great opportunity as a community to feed back what things are happening on the ground and to work in partnership to try and change policies so that they're right for our children and young people. And this work is recognised through a number of different sort of funders, and that's allowed us to bring inward investment to support this sort of work. And our strategy over 2022 is to build on that work and pull in inward investment that will really allow everybody to drive forward the changes that we all want to see. So we have this incredible infrastructure and we have a phenomenal community. I'm sure on this call we have a number of our evidence active champions, individuals that are sitting through our school sort of system, ensuring that our schools are using the best possible evidence in their decision making, but also supporting our efforts to work in partnership to get a solid evidence base so we know what works, what's effective in tackling mental health problems in schools, what's effective in ensuring the best possible practice in parental engagement, and so on and so forth. A fantastic community that lie at the heart of the Centre for Applied Educational Research. And we have good methodologies that we want to drive forward over 2022 that allow us to take promising approaches, test those approaches, establish an evidence base, and go all the way through to national rollout of interventions with an evidence sort of a base, allowing us to translate promising research rapidly but safely into policy, making sure that education has the same adherence to good evidence as we expect rightly within our medical services. And CAER really supports that rapid sort of translation and encourages schools and academics and health sort of services to come together to use this methodology in order for us to create change, not just across our district, but nationally and ultimately internationally. And we've got a good track record in doing this, but we want to drive this harder and faster over 2022. So for example, we've run the Glasses in Classes sort of a project, a small project that started in Bradford, where we could show that a number of children were being identified then were not getting the requisite pair of glasses that they needed in order to see. And what we could show through the connected data sets is that was having a direct impact on children's ability to learn to read. It turns out that being able to see is incredibly important for learning to read. And what we could then do is start testing innovative approaches to tackling that problems, looking at how we could share information between our health services and our education services, looking at how schools could support that barrier to education experienced by so many of their children, and then establishing a randomized controlled trial, and then looking at how we could take that learning and start scaling up nationally. And so it's a great honor for us to be supporting the Department for Education as that work is now being rolled out across the country. So we have a number of examples where we've rapidly been able to take promising evidence-based approaches and scale them up to national pieces of work. And as I say, our strategy, our desire over 2022 is to make that happen across the piece. And in order to do that, we're really concentrating on 8 specific areas, 8 specific themes. Lucy has been doing phenomenal work in trying to create our website, the Centre for Applied Education website. We're now going to get some professional developers to make it look pretty, but please do go and have a look at the CAER website, where you will find all of the different pieces of work that are happening. And we want you to look at that website so you can see how you can get involved, how you can play your role in allowing us to achieve our goal of eradicating inequality, of improving the physical health of our children and young people, improving the mental health of our children and young people, improving the educational attainment of our children and young people, and ultimately driving sort of social mobility across our region, across the country. So we have 8 specific themes filled with incredibly exciting projects that are utterly inclusive in their heart, areas where we want people to come together to help us drive forward change, evidence-based change. So we have great work being done around understanding and supporting children's cognitive development, and looking at children's language abilities and trying to understand what are the barriers and opportunities afforded by children who have English as an additional language. So great work being driven forward by Cecile, looking at these language issues and trying to understand how we can support sort of schools to help tailor education to children on the basis of their language abilities. And we're going to be having future sort of webinars, and we'll be hearing later today about some of that speech and language work. We similarly have fantastic work being done by Amanda Waterman, looking at how we can support children's ability to hold information in their working memory and then apply that within classroom. And Amanda's working with Mark Miller from our research school to start seeing how we can support classroom teachers to help children overcome difficulties with working memory. So exciting curiosity-led research, which is being translated and applied to classroom settings. That's the modus operandi of the Centre for Applied Education Research. And similarly, we have teams of individuals looking at how we can support children with neurodiversity. And one of the projects that we've been driving forward and that we'll be really focusing on over 2022 is work around the use of routine data sets to identify children at risk of special educational needs, including, but not limited to, autism. And looking at how we can start moving from a very diagnosis-led system to a needs-based system. And this is work that's being done in partnership with academics, with data scientists, with our educational psychologists and teaching colleagues to start looking at how we can empower classroom teachers to identify children's strengths and weaknesses as they relate to neurodiversity, how we can improve the patient pathways so that children who need additional sort of support from our specialist CAMS teams and our specialist pediatricians sort of our teams can be prioritized, how we can revamp our systems so they're fit for a purpose, so that every child gets the help they need at the earliest possible moment. And data are going to really help us in that piece of work. And we've established an integrated data analytics unit that will be looking at how we can better use our data sets, how we can better connect our data sets to visualize and explore the intersections and interactions that occur between these different factors as they play out in children's life. And so we have a whole team that is looking at how we can start to share information more effectively across the whole system. So that instead of having pediatricians who are trying to make safeguarding duties with no understanding of what else is happening in a child's life, we can start to have that shared information, or where the classroom teacher can start to have an understanding of what medical problems a child might be experiencing that are impacting upon their ability to acquire educational qualifications. To start to use data to join up the system so we can work together effectively. And we have great pediatric colleagues who are going to be driving forward work, looking at how we can start tackling the non-communicable disease epidemic that's playing out across our region and exasperated by COVID. And our strategy is going to be to look at how we can be more effective in stopping children needing to come to hospital, how we can start looking at issues related to obesity and the issues that then come from high rates of diabetes and high rates of other non-communicable diseases. And we have fantastic colleagues who are looking at how we can start to create better environments for our children. So Kath Noakes is leading us in work around looking at how we can improve air quality within our building to improve the learning outcomes, how we can try and use air cleaning technologies to make our classrooms safer. And we're very proud to be running the national trial on the use of air cleaning technologies within our schools, only made possible because of the incredible partnership that exists between our school system and our health system, our connected data that allow us to start seeing what the impact of these technologies is across the whole system. And then we have work targeted on children's oral health, recognizing that dental problems are a major barrier to education in some of our most disadvantaged communities, that children suffering from toothache are unlikely to be able to learn effectively. Recognizing that one of the major issues for school absences across our district are children leaving school to have dental treatment. So we're working together to try and remove health barriers to education, again, in partnership. And the pandemic has exacerbated the mental health epidemic playing out across our school system. So we're delighted to have an incredible team of individuals looking at supporting schools through the prism of social and emotional mental health. We've established a What Works Centre for mental health that will allow us to trial different innovative approaches under the leadership of Simon Gilbody from the University of York, the leading psychiatrist, who will help us understand what works for whom and how it's best delivered. We've got a fantastic team of individuals who have created mental health support teams already operating in a number of our schools, about 30% of our schools. And the question is how we persuade Amanda Pritchard, who came to see this great work, how do we persuade Amanda Pritchard, head of NHSE, to change that from 30% of schools being supported to 70%? How do we act as advocates for that type of investment? We will continue our strategy of working with our public health colleagues to try and simplify things for the school system, to allow schools to identify the offers which are most suitable for them to support children's physical health and mental health, or tackle classroom inequalities. The Age of Wonder project is opening up all kinds of possibilities for us as educators, as scientists, as policymakers, working with 30,000 children and young people, collecting rich data on their lives. And of course, we're using digital technologies to collect those data, which has allowed us to create the Digital Makers program, looking at how we can digitally upskill all of the children across the whole district. And this has got huge sort of support from major industrial sort of players, including Raspberry Pi, who will be sitting down with us this month to look at how we can start making coding clubs available to our schools, coding clubs that take into account all of the school's sort of needs, not just the issues from inside the school gate, but the issues on the other side of the school gate. Physical activity is a big focus for us over 2022. So there's the incredible work that the JUMP team are doing, £10 million inward investment to look at how we can encourage a whole system approach to helping children be more active. We have run the world's largest randomized controlled trial in handwriting interventions. We have a team that are looking at how we can enhance learning through physical activity. So physically active learning is developing a good evidence sort of base. So are there ways that we can educate sort of our children more effectively that also encourage them to be active? And a big part of our strategy over 2022 is really going to be to see how we can enhance and grow this sort of work. And then finally, our 8th theme is very much focused on how do we ensure that children are school ready? So how can we support children preschool from birth to 5 years to give them the rich experiences that we know are so important for cognitive and physical development? And it's such a privilege to be working with Christian and Andrew and the team who've developed this incredible app, the 50 Things Before 5 app, that really gives us a framework for starting to understand it and explore how we can help families, how we can help communities to provide rich experiences that are accessible to all. So that's a whistle-stop tour through the 8 different sort of themes that we're going to be developing and pushing forward on over 2022. And again, we'll just really encourage you to explore our website. And what we'll be doing this next month is creating a brochure that lays out all of this information in physical format, and that will be distributed across all of our partners so that everybody can start really understanding how all of these different things fit together, and most importantly, starting to see how they can bring their skills, expertise, and willingness to bear in order for us to get everything aligned, work together in harmony, and make this incredible vision a reality. So we have a plan, we have an inequality plan for sort of a district that's going to help us ensure that we deliver these approaches effectively. And we're not doing this in isolation. It's very much our strategy that we push our learning to value sort of our colleagues nationally, but we also put in expertise. So we will be bringing expertise from around the country in order to help us in our endeavours. And we have fantastic international sort of our partners. So again, we will use those international connections to help ensure that the work that happens within sort of our care benefits not just the children in our district, not just the children in our county, not just the children in our country, but children throughout the whole world. Because this is the most important thing that we can do as a community. Support the next generation, give them the tools that they're going to need in order to thrive and survive as we face the various existential sort of challenges of the decades to come. And ultimately, our strategy is to become the voice of children and young people, to co-produce all of these incredible programs of work with the communities, with the families, with the children. And through programs like Age of Wonder, we really have the opportunity to capture all of those voices in everything that we're sort of doing. And the relationships that CARE enjoys with central government, with local government, with great organisations such as the Royal College of Paediatrics and sort of Child Health means that we have the opportunity as a community to shape policies regionally and nationally. And we can act as the voice of those children, young people, those most disadvantaged children, young people, so that we can do everything in our power to make certain that in 10 years' time, the children, young people who have suffered so greatly through the sort of a pandemic have really, really done brilliantly. That's the vision. That's the goal. I apologise for not being able to articulate it very eloquently. But I hope you will just sort of take the opportunity to have a look at the sort of website, engage with us in order, as I say, that we can really change everything for once and for all. Okay, so that's where I'll leave it. That's my whistle-stop tour through our sort of strategy for 2022. Please do join with us. Help us be this incredible sort of voice for our children and young people, and help us work together in partnership to make these other changes. Right. That's more than enough for me. This has all been about the partnerships that are working that we enjoy. So it's with great pleasure now that I'm going to hand over to one of our colleagues in pediatrics, Zainab. So these webinars are all about us coming together to share sort of a learning in response to the pandemic. They're going to be transitioning now to a response to how we can mitigate the aftermath of the pandemic. But they'll still retain at their heart this idea that we bring stakeholders together, we bring the community together in order to really ensure that we leave no stone unturned in supporting our children and young people. So Zainab, can I hand over to you now, and we'll hear what's happening in the world of pediatrics.
Camera. I don't know if you can see me because I can't see myself. Can you hear me?
I can hear you. We did see you, Zainab, and then...
Oh, and then it disappeared. Okay, I've connected it again. Let's see. Just let me know when it's working.
Zainab, maybe just try.
Great, I'll start talking, and if the video comes up, then that would be great. Thank you very much, Mark. My name is Zainab Izimokai. I'm one of the pediatric consultants over in Bradford. I'm a general pediatrician. I have an interest in infectious diseases and immunology. And I just wanted to express, first of all, how keen we are as a group of pediatricians in Bradford to be able to connect our pediatric services with the school system. So it's been really fantastic to be able to join this meeting, to get this connection going so that we can all work in partnership with our children and young people across the region. Is the video working yet, Mark?
No, but we can hear you really clearly.
Okay, that's great. I know there was a question about long COVID, and what I wanted to do today really was just to update you with regards to what's new regarding COVID, what we're seeing in the hospital regarding COVID, talk a little bit about our wider determinants of health, and just very briefly about safeguarding. So with regards to long COVID, there have been different studies that try to find the prevalence of COVID, long COVID in the pediatric population, and they've all basically come up with different percentages. The last one I saw in the Lancet said the percentage was about 1.8% among children with COVID who developed long COVID. But what we're seeing in Bradford really is we're not having that many pediatric patients come through to us with long COVID. There is a service for long COVID in Leeds where we refer them. There's a special clinic, and also that clinic has a very little uptake of patients with long COVID. So I don't know if these patients are not presenting to their GP and they're not being referred to us, but we're actually not seeing that many of them. And I wonder if there's a question from the teachers about this, and if they're seeing children with long COVID or symptoms that appear to be long COVID. But it's just to let you know that you can signpost the parents to go to their GP, and there is a service in Leeds, and there's a special clinic for children with long COVID in Leeds. And with regards to COVID-19 itself, just as it has been from the beginning of the pandemic, we're hardly seeing any children presenting unwell to hospital with COVID-19. And that's the same in Bradford as it is across the world, really. In the last few months, and just to give you a little bit of background, all the pediatric patients that come into hospital get a PCR for COVID-19. In the last few months, we have had a lot more patients come in that are positive for COVID-19, but they're actually coming in presenting with other illnesses. So we're having a lot more asymptomatic children with COVID. What's new with COVID that will be important for the school and us to know in the community? So since there are not that many children presenting unwell, we want to prevent those children who are at a high risk from coming into the hospital unwell with COVID. So there's now, the NHS has now rolled out a monoclonal antibody and an antiviral that can be given to high risk children that are positive for COVID and are symptomatic. So this will be relevant, I think, probably to teachers in the special needs school, because most of these high-risk children are probably coming from there. So we've started to send out letters to these children's homes from the GP and from the NHS to the high-risk children, letting them know that if they develop symptoms for COVID and if they're positive for COVID, we can actually treat them in the community to stop them presenting into the hospital unwell with COVID. What else is new with COVID is now we have vaccine. So the vaccine is now being rolled out and expanded to the age group of 5 to 11 years. But this is in a high risk group. So that's important also for the special needs school, because a lot of our high-risk children are in the special needs school. So it's just important to know that from 5 to 11-year-old and a high-risk group of children, they can now have their COVID vaccines. And in the next couple of weeks, and it has already been sent out, letters will be sent out to these patients and to their families. With regards to the other determinants of health, it was really good to see as part of Mark's presentation about obesity, because I started working in Bradford Hospital in 2021, last year, and I did a clinic, my first couple of clinics for a colleague, and I thought I'd mistakenly done an obesity clinic. Most of the patients that I saw in clinic were obese, and a lot of them were morbidly obese. So it is quite a very concerning feature in the population in Bradford. It was also great to hear about the mental health support worker in schools, Mark, and we'll definitely be supporting an increase in the mental health support workers. Whether it's because of the pandemic or in general, there's a lot of mental health in our children in Bradford, a lot of anxiety, and it would be great if they could have that initial care from the school that might even prevent them from presenting to the hospital. And with regard to safeguarding, I just wanted to say a big thank you. Teachers have been doing a fantastic job. A lot of the cases that I see with safeguarding from the social services have been referred in from schools. Teachers spotting these children appropriately, referring them to the right places, and then coming to the hospitals for medicals. So there's already been a great connection happening between the schools in Bradford and our health services, and we would like that to continue and would like to expand on that. Another really fantastic thing that I've gotten from school is letters regarding children's behavior, regarding their development, regarding their home condition, regarding their school attendance. I got one fantastic letter that really helps with the management and the whole holistic management of the patient. So I just want to say we have been doing a fantastic job with connecting with the schools, but of course we would like it to be a stronger partnership. So thank you very much, Mark, for this opportunity.
Thank you so much, Zainab. Great to have you on board, and just really appreciate the fantastic work that you and the other presenters have been doing, and your great support for these endeavours. Yeah, really appreciated, and wonderful just to hear the great job that the schools have been doing, which just reflects everything that we're hearing, which is why we just want to pull all the possible sort of support together to support sort of our schools in this sort of a space. Right, so we will now have our regular public health update. So Duncan, can I hand over to you and Martin? Duncan was there 2 seconds ago, seems to have disappeared. Duncan, are you there? Or Martin, do you want to step in? Christian, can you see Duncan there at all?
Yes, I can. Duncan, it's on screen. Just briefly came on again.
Okay, I'm guessing Duncan's having some connection sort of problems. So Ros, should we move things around? Can you give us a Living Well Schools update? Oh, Duncan, are you ready to go now?
I am, yes, sorry about that. I always struggle with Zoom because I can't use my laptop. I've Mark or Christian, I've sent you some slides. Is it possible for you to share those?
Yes, I'll try. Just a minute.
Okay, thanks for that. So I just want to give you a really quick update on the COVID situation in Bradford, particularly with schools, and then Martin's just going to bring you up to date on a few of the other sort of more on the ground bits and pieces and vaccination. So a couple of weeks ago, I said, putting my life on the line, that I thought we were at the peak of Omicron in terms of schools, and we're just going to sort of go over that. Okay, can I have the next slide, Mark? So the background to what's happening in Bradford. So the numbers of confirmed cases in Bradford district's been falling for a couple of weeks now. We've had about 140,000 cases in all. That's a complete underestimate, but the majority of the population now have got some sort of immunity to COVID, either via vaccination or having the infection, and we're down to under 1,000 cases a day, which we haven't had for a while. The overall rate's gone down by about 20% in the last week and started to fall for school-age children as well. So in terms of Bradford and how that compares to the rest of the country, I've got the rate there, which is about 1,000 to 100,000. So the mathematicians in you will see that's about 1% of the population are testing positive at the moment. And that's similar to the regional and national averages. All age groups in terms of infection rates are falling, and it's been in the last week or so that we've started to see that in school age children as well. But the lateral flow test programme, in terms of all the encouragement that you do around that, and I know this testing still going on in some schools as well, that's picking up about half of our cases at the moment. So really important part of our prevention strategy still. Next slide, please, Mark. So this is what I just tried to give you, sort of overall picture of how young people and children have fared. So these are the 5 waves of COVID in one slide. Starting from way back, it was 2 years ago to the day almost, where we had the first case of COVID in the UK. So 2 years has gone by, if you can believe it. That was our first wave of COVID that came from Wuhan. And then in October 2020, January 2021, that's when we had our second and third waves, and that was the Alpha variant that emerged in Kent, or was discovered in Kent in the UK. And you'll start to see the rates go up, mainly because our testing became a lot better. So first of all, we had the community PCR testing, whereas it was just mainly in hospitals in the first wave. And then we had the lateral flow tests coming in early 2021. In July 2021, that's where we saw the emergence of the Delta wave, which will really hit schools. And then you'll see in October 2021, arguably, schools have seen 6 waves of COVID because there was this big increase. That pale blue line there is the 0 to 15-year-olds. So it's our preschool key stages, mainly 1 and 2 there. And then what we've got now is this 5th wave, which is Omicron, and that's starting to fall in all age groups now. So these are all rates for Bradford. Okay, next slide, please, Mark. So in terms of what that means in age groups, the right-hand bit of the slide there, as you can see, that the last 2 weeks, arguably, in the preschool, we've started to see a fall in rates, and the red and the blue lines there are primary and secondary schools. So it's just been the last week that we've seen that big drop, which is good news. You might not have experienced that in all schools, but that's a population level approach in terms of our overall rates, and it's decreased in all those 3 age groups. Next slide, please, Mark. So this is just to give you some idea of the numbers, and you can see if you look in the middle 2 columns there, the primary school age 4 to 10, that's probably where we've seen our biggest drop. I think what was different perhaps about this wave was the relative impact on primary schools. So a bigger proportion of cases in primary school children with Omicron, slightly different sort of virus, more like a common cold, more prevalent in the upper respiratory tract, so passed around more like a common cold. And you can see that's dropped from 1,200 to under 700 cases, so it's almost halved in the last week. Next slide, please, Mark. Yeah, and then in terms of how this impacts on this, so this is the data that you've been reporting through to us, which we sort of rely on in terms of how we know the school sector is responding. So the bottom blue line there is the numbers of cases in staff. Again, with Omicron and the amount of testing that we've got and the infectiousness of Omicron, this is where we've had so many more cases reported in staff and teachers this time, but that's dropped as well. Just as it has done with the actual school age cases as well. Okay, next slide, please. And in terms of the vaccination rates, Mark's going to talk about this. I mean, this is the most important. I know it's more difficult for you to influence this from within schools. And the second round of vaccinations have been going through secondary schools in the last sort of 2 or 3 weeks. But then it will go back more to primary care again. It's really, really difficult. I know you can't have long conversations with children about this, and you can't have long conversations with their parents. But anything we can do in terms of promoting vaccination, reminding people about it, is still important, because this is going to be going on for a couple of years in terms of the vaccination. It will fade into the background like a flu vaccination strategy, but we still need to be reminding families about vaccination. It's probably our biggest prevention arm. So we've still got about 40% of eligible children that are eligible for a dose of COVID-19 vaccine that have actually taken that, and there'll be increasing work going on in terms of those high risk and more vulnerable children in special schools with vaccination. Okay, so finally, outbreaks. This is just to show you that they have gone down. They were fairly huge. We had 17th to 23rd of January, 117 outbreaks in terms of our old outbreak definition, and that's gone down to 87 outbreaks in the last week. But we've got 30, we know there's 30 schools that we know of that have still got 5+ cases in staff that are having to isolate. So what we're moving to now is an endemic situation. So disease reach endemicity when you've got them constantly circulating. And that's what we're going to reach with COVID now. So arguably our old outbreak definitions aren't very useful anymore as we're moving to a post-COVID period. So we might have relatively high rates for a few weeks, and this really is just going to become the new normal. And we're at the moment, we're in this sort of limbo period, and I realise it's really difficult for you, and it's difficult for us all at the moment as we're sort of heading towards the period when these restrictions come off. So in terms of the public health advice, particularly around wet face masks, the justification for the sort of blanket advice to you in retaining masks in staff and in secondary schools in crowded areas as well, that's weaker. There isn't such a big justification. There's probably a greater justification for following the government line now. But we know that a lot of schools are still suffering from serious disruption. And under the current guidance, staff and young people have to isolate for 5, 7, 10 days, depending on the vaccination status. So it is still very disruptive. So in terms of that, while we have these regulations, our advice really is to support you. And there's in terms of maintaining face coverings, you know the rates in your school. As I said, those outbreak definitions aren't very useful anymore, but you know how much it's going around schools and how bad it feels in terms of disruption, and we fully support and decisions you use in maintaining face coverings. So face coverings, ventilation, vaccination and testing, those are the sort of 4 pillars of prevention. What we're hearing nationally is the whispers are that all restrictions are going to go in March. We haven't had anything official coming through on that yet, but that certainly seems to be the way that we're going. But I certainly think for the remainder of this half term, we will see a lot of Omicron circulating. So face coverings are there for you to flex within secondary schools as you feel that you need, and we'll support you in those decisions. Just the other thing to say as well, in terms of following up Zainab's sort of great overview, is that there's been a really useful paper published on the safety in terms of numbers of COVID deaths. It's not a very nice subject, but a year's worth of data has shown that 25 children over a 12-month period in the whole of the country died as a direct result of COVID. So that's 2 per million. And to put that in context, every death of a child is tragic, and COVID and any other cause, but that's 1/10 in terms of the death rates of deaths from accidents on the road. Or another way of looking at it, if a child gets COVID, they have a 99.995% of recovery. So it is, on the whole, it is not a serious infection. So that's why I think, in terms of the restrictions that are starting to come off now and getting back to education, protects children and improves their long-term future, obviously very safe environment in schools for children from difficult backgrounds as well. We're really supportive of the measures eventually coming off. So I'll leave it there, Mark. Martin's probably got a few words to say as well about what's going on the ground.
Fantastic.
Hi everyone.
Thank you. Thanks. Okay, over to you, Martin.
Hi everyone. Yeah, thanks, Duncan. So just a couple of things from me. If I do drop out, by the way, and I've been dropping out quite often this afternoon, I will just put what I'm about to say in the chat because it is very brief. So just on the back of what Duncan said, please, those of you who are sending in the web forms, please continue to do that. That's really important so that we can track the data across the district. And if it's gone off your radar a little bit, please get it back on your radar and keep sending the cases in. In terms of vaccinations, as Duncan said, that programme for secondary schools continues. So if there are any problems, please contact the SIZE team initially, or if you can't get hold of them, then just come via me and I'll get through to them for you. Those of you might have picked up in the DFE weekly bulletin that the sum of £1,000 minimum is going to come into budgets in April to support your delivery of the vaccination programme in school. So if you've missed that, just make sure that you've picked up on it. It'll be coming into your budget shortly. And also on the 5 to 11-year-olds, the vulnerable children in special schools, that we do have a webinar with the SIZE team this time next Thursday, 4 p.m, that you should have had an invite to. I believe the invite went out to all schools, or pretty much most schools, and it is just for the special schools who are going to be hosting the SIZE teams on site. So if that applies to you, be a chance to listen to the details of the programme, and also there'll be a Q&A so you can ask what the details are and how it's going to run for you. So that's 4 p.m. next Thursday. Other thing from the DFE, just to bring your attention to, is that we had the talk about CO2 monitors last time in the webinar. The deadline for asking any questions or resubmitting your application to receive the outstanding ones, if you haven't got enough, is next Thursday, again the 10th of February. That was in the DFE email that went out as well. If you've missed any of that, I will put that out in Sue's bulletin tomorrow. So yeah, just to finish, rates are still high. We'll probably reach 1,000 again this week. So it's still there, but keep at it. And of course, we're always here for any support or any questions that you need. Okay, thanks.
Thanks so much, Martin. Thanks so much, Duncan. Super useful, as always. Kath, our notes gave us a great session in our last sort of a webinar on how we can sort of prevent used carbon dioxide monitors. She's pointed out that there is an article now in TES that we put. Thanks very much to everybody who contributed to helping us hopefully give some clear advice to sort of our schools. That is in TES. We very kindly removed the paywall because they thought that this work was so important to schools. It's a great testament again to the work that everybody's doing in partnership. So getting the school's voice in there, getting our academics sort of our insight, health insights, to give some nice clear guidance that can go out nationally. That's definitely the model that we're looking for over 2022. So thanks for that. Just to remind colleagues, everything that we talk about, all of these links, we send out afterwards. So we will get all of this information to everybody once this webinar is sort of finished. But what we'll do now is hear an update from Living Well, which I sort of flagged, but this great piece of work that Public Health are leading on, where we're really just trying to clarify the offers that are available around things like physical health and mental health to make it just easier for schools to navigate. So Ros, can I hand over to you and can we get an update on where we're at on Living Well School? Christian, I'm going to ask for your help again. Can you see Ros there?
I can't, but I do know.
Oh, there's Ros. I can see her now.
Ros is here now.
Ros, I'm not hearing you. Can you try unmuting? Or it doesn't say mute, but I can't hear you. I don't think other people can.
No,
definitely not hearing you.
Mark, I know.
Mark, do you want me to Shelley might be on the call, because Shelley was going to go over some work as well that we're going to be doing with schools in Bradford.
Perfect.
Shelley, are you on the call?
Do you want me to kick off?
Yeah, that would be great, Shelley. Sorry, I think Roz is having a few connection problems.
No worries. Let me just share something so that you're not just looking at my face. Even though maybe it's better to look at my face on the slides, I don't know, let you decide. So thank you so much for inviting me along today. What I want to tell you about is an exciting new research project that I'm working on in collaboration with Bradford City Council. My name is Shelley McKeown-Jones. I'm a social psychologist, researcher, educator at the University of Bristol. And as you may be able to tell, I am from Northern Ireland. This project is a project that's just kicked off earlier last year, working with young people and various organisations in Belfast and in Bradford. Now, what we're trying to do here with this project is understand more about the things that influence whether or not young people choose to interact with those from different religious or ethnic groups. So really focusing in on a social cohesion agenda, and I'm sure I don't need to convince you as the audience that promoting social cohesion is really important for the outcomes of young people. So really working on the idea of evidence-based practice and how important that is for the school context. So what am I looking for? So I'm looking for secondary schools who are passionate about promoting social cohesion, tackling racism, and understanding more about promoting community relations in schools. Now, the rationale behind this is I have worked quite a lot with schools in Northern Ireland and in other parts of England to design teacher toolkits, look at intervention materials in co-production and evaluate those using robust methods. And we know that if you interact with different groups and those interactions are positive and meaningful, that can reduce prejudice, but it can also promote more participation in society, civic engagement, helping others, boost creativity, and all of the kind of things that we want to do with our young people as educators. But what we know much less about are the things that influence whether young people interact or not in the first place. So this is where this project is a bit different. So we're kind of looking at not what the effects of good contact are when it does happen, but how we make it happen in the first place. So the idea is that this project, through working with schools, with young people and with their parents, that we'll understand better these factors so that we can inform intervention. So if we know that it's really important to work at the school level or the family or community level, that we can better do that. So what I'm seeking is a very complex project. So I'm asking you for one tiny thing at the minute. I would love to hear from you if your school would be interested in getting involved. What the first stage will comprise is getting young people to fill out a survey. So it'd be 14 to 16-year-olds in the schools. We would come and facilitate that, do it in tutor groups in the morning, whatever, free periods, whatever suits best for the school. And we'd have a conversation with you about how to do that. It'd be an online survey. If we need to do paper and pen, we will. We'd need to send information out to the parents and make sure that they're aware of what's happening and also seek their participation if they'd like to do so. The survey would ask things about young people as themselves, so whether they're open to experience, whether they like hanging about with other people, what their interactions are like in general, to what extent they think their school supports them to interact with people from different ethnic groups, to what extent their family does, and the kind of things they do in their local community. Every young person that completes the survey will be given a £10 Amazon voucher to say thank you. And every school that takes part will be given around £500 just to say thank you for supporting and facilitating the participation. So why should you take part? I hope that this will be interesting to the Bradford context. I've worked a lot with Zara and Bradford City Council to talk about the relevance of this, and also with Roz, and I hope that will really inform policy and practice in Bradford, in education and beyond. What we'll do for you is also produce you a bespoke report that tells you about what's happening in your school. Your school would never be, what's the word? Your school would remain anonymous, that's what I mean. So if you've got a school where you have concerns about cohesion, or you've got a school where it's doing really well, what my reports will say is that schools in Bradford took part. I won't mention your specific school. So individual school information is not going to be released in any way. So just to wrap up, because I'm aware that Ros doesn't have very much time on the agenda here, just to say thank you for listening to me at 5 p.m. In the evening, when I'm sure you're all very tired already. And if you're interested, really want to get participation from Bradford, we're also working in Belfast and we've got schools on board there. So would like to get those who are really interested and passionate about it, you can email me. I'll hang around for the rest of the session. So if you want to PM me on the Zoom chat, or send me an email now if you're interested, that would be fantastic. So I'll leave it there.
That's great. Thanks, Shelley. Anything else from Living Well Schools, Duncan?
No, Ros, just a couple of things. First of all, just to finish on what Shelley was talking about. And the reason why that we're supporting this, and I'm just asking for a few schools to really get in touch and think about whether this be useful, is that the youth ambassador priorities that we get sent back, and we've had those back every week right through COVID, talk about racial tensions so much. It's one of their priorities, and so many of those reports that we've had. So really would appreciate your support on this. And there's £10 vouchers obviously for the kids, and a bit of funding for the support. So please get in touch with Kelly if you're interested in that. There's nothing else, Mark. So I know we've got a packed agenda. Ros has got an update on the Poverty Proofing the School Day, but we're just about to send out the first newsletter to all schools, specifically from the Living Well programme. So I think that'll make this stuff a little bit more accessible for you and give you direct links onto the website where all that information is. So expect that in your inboxes in the next couple of weeks.
Fantastic. Okay, well, thanks very much to the public health team. So as I talked about sort of earlier, what we're going to start doing these future sort of webinars is bring everybody together around specific sort of topics in order to really sort of act as sort of advocates and sort of shape sort of our policy. So we will be having a very specific sort of session on one of our major themes around speech and language. But just to get us primed up, we're going to have a small sort of section on speech and language today. Christian, can I hand over to you to do the introductions?
Yes, thanks, Mark. It gives me a great deal of pleasure this evening to be inviting Becky Earnshaw from Voice 21, national organisation supporting schools, young people, families, teachers in the space of oracy. Have been established and doing fantastic work with schools, including and very significantly in Bradford, to support the development of speech and language right across the age phases. Our next webinar is one which is going to have a special focus on speech and language. And to set the scene for the special focus, I've asked Becky to come along here this evening to talk to us just for 10 minutes. And I know their organisation will be also supporting our next webinar. And I'll hand over to Becky now. Thank you, Becky.
Thanks so much, Chris, and thanks so much. It's great to be joining you from London today, and it's really nice because, as Chris said, Bradford was one of the first areas that Voice 21 worked in, and many of our kind of ideas were developed from the work that we did with schools in Bradford, and it's been great to see how that work has continued. And I think Bradford, we talked about it as our Aura City, and a place where it had always taken speech and language very seriously and at the heart of much of its thinking, and never has that been more important than now. And so it's brilliant to hear from you all that continues to be a huge focus and something that you're going to be focusing on more specifically in future conversations. So today I'm just really going to give you a very quick overview at a kind of national level in terms of where things are, in terms of some of the challenges. And Voice 21's work is very much around kind of the universal support of language development in schools. So we're not specialists in children with speech and language and communication needs, although obviously we interact and work with those who are, and we're very much supportive of the agenda and the need for a greater focus on that. But just to be clear, you know, we're coming from that kind of what should be happening in all schools, and how can the work that happens at a universal level across early years and in all schools support all children, particularly those of the highest need in terms of disadvantage, but also help to support schools in identifying and focusing resources around those children who have got specific speech and language and communication needs. So I'm sure none of what I'm going to say is going to be a surprise to any of you, particularly those of you who work at schools. Everything we talk about will be very recognizable and absolutely at the you know, what you're seeing in your classrooms every day. But it is worth saying that, you know, one of the things which has become very clear over the 5 years that I've worked at Voice 21, but I think that has been a truism for much longer before that, is that, you know, the evidence around the importance of good talk and of language is hugely robust and clear. You know, there is no doubt about that. Becky Francis from the Education Endowment Foundation says, you know, the one thing that we know is about the power of talk, you know, that this is absolutely fundamental. And fundamental to that, there's been a growing understanding that this isn't just about, and it isn't primarily about the number of words that children are exposed to, but is very much about the things that 50 things to do before you're 5, for example, focus on, around how do we create high quality interaction, and that interaction that happens parent to child, interaction that happens teacher to child, and how do we ensure that children are getting involved in as many different interactions, and that those interactions are high quality and exposing young people to different language, different vocabulary, different modes and contexts for talk, which help to develop their understanding as well as their breadth of language. So you know, that's the kind of the area that we're coming from. It's not about how do we fill children with loads of words, but how do we enable them to be part of language rich environments and be part of a communication that grows their understanding as well as their range of language. And we need to do that because good language is central to literacy, numeracy, academic attainment, but also to so many other long-term life outcomes, and that includes well-being. And we know very heavily that children in areas of social disadvantage are at the greatest risk of poor language skills or lower language skills below their peers, and we'll go into that in a bit more detail in a second. We also know very clearly that the pandemic has left children of all ages behind in speech and language, and you will have seen that in many of your schools. And in a moment I'll go on to some of the statistics about how concerned teachers across the country and school leaders are about that, and therefore there is a real need to improve the universal teaching of spoken language in all schools and the provision for particular specialist support for children and young people who have particular needs. The recognising that centrality of spoken language to children's life chances will help us to address some of the impacts of the pandemic. So you know, we're all, I think, frustrated by perhaps the lack of coordination around some of the work that's gone on to try and look at how we can address the problems of the pandemic. But also, to be honest, this has never been something which has had enough focus. It's never been an area that has had the right level of investment. It's always been too much of a postcode lottery. And if you talk to schools in different areas, there's a huge range in terms of the provision and the quality provision and the access to really high quality language teaching in schools, high quality oracy, and also the provision of particular specialist support. And that means that we have this disparity in different areas, and it's not good enough, frankly, and it's particularly not good enough when we're in a position of having to address the needs of children who have had the impact of the pandemic laid on top of the fact that they are perhaps already were in areas of social disadvantage and had a lack of provision. So in terms of those language skills, 1 in 4 children who struggle with language at the age of 5 don't reach the expected standard English by the end of primary school, and 1 in 5 children who struggle with language at the age of 5 do not reach the expected standard maths at the age of primary school. So, you know, this is absolutely, the government are talking at the moment about the kind of literacy white paper, and you will have seen, I'm sure many of you spent your evenings wading through the 300 pages of the Levelling Up white paper, which talked very much around the central role of education and the need to develop, the need to focus around literacy at the end of primary. Well, you know, if we don't speak up for the importance of oracy and language development as part of that, then we're never going to get there. You know, this is absolutely critical and underpins any of those other efforts to try and address focusing on literacy or numeracy at the end of primary. If we don't focus on early language, we're not going to get there. And as we talked earlier, that intersection between social disadvantage and language is absolutely clear, that by the age of 3, more disadvantaged children on average 17 months behind their more affluent peers in terms of early language development, and as many as 50% of children in areas of social deprivation start school without the language they need for learning. And unfortunately, currently the evidence suggests that that gap grows rather than narrows as they move through school. So it's not a case, unfortunately, what we're doing is enough in terms of narrowing those gaps. The gaps actually grow. So there needs to be a concerted effort to look at how we can create, particularly in those early years, but sustaining beyond that, a really language-rich schools that know how to support and develop young people's oral communication skills. The long-term impact of that, and I know that we're focused specifically around those early years, but today, the long-term impact of that is that that we see those outcomes going through into later life and life well beyond the school gates. So unemployed young people are almost twice as likely than those in employment or full-time students to feel that their schooling did not give them sufficient spoken language for success in later life, and almost twice as likely to say that their education didn't help them develop the good oracy skills they need to progress. So that's, for those young people who are looking at, like, we want for all of them to have successful lives and to be able to access employment and opportunities beyond school. But then if you start looking at the prevalence of young people with particular communication skills in, for example, the criminal justice service system, there's a massive correlation. And so the impacts of this are wide and long lasting. So what can we do about it? Well, clearly, I know this is going to be focused in much more detail of future sessions, but we need to address the variation in teaching and learning in schools around development of speech and language and communication. And there's a huge variation, and the studies, we did a lot of research for a recent all-party parliamentary group on oracy report that came out in April, which is called Speak for Change. I suggest you look it up. There's loads of research in there, but what it found was that there's a huge variation across the country in the time and attention given to spoken language, and that means that we're kind of leaving it to chance. This stuff is caught rather than taught in too many schools, and I know that's not the case in many Bradford schools because we've had the opportunity to go in and see it, but that there's still always more that can be done. The development of spoken language skill requires, from our point of view, the purposeful, intentional teaching across all ages and stages, and we need to understand what that means and what that looks like, and how we make talk in the classroom really purposeful and ensure that all classrooms are really language-rich spaces. But less than half of primary teachers and a quarter of secondary teachers say they're currently confident in their understanding of the spoken language requirements outlined in the national curriculum. So, there is, what do we want to do in all that? I think all of us would argue that the national curriculum doesn't go far enough in this, that spoken language is given fairly scant regard within it. However, even within that, there's a real lack of understanding, and that's probably because it's really unclear. But we want to support teachers and schools to be able to have a really strong idea about the curriculum that they want to offer to develop spoken language, and how that starts from the very earliest stages right the way through. The impact of the pandemic has brought these issues into really sharp focus, and I would love to know more about what the situation's like in many of your schools and settings. I think it's, there is a variety of responses across the country, but 96% of schools were concerned about their school starters' language and communications needs in September 2020. So schools are really concerned about the level of language that those children coming into reception had, and I don't know whether that's been the situations in your school, whether you've seen a significant drop off. I see some nodding going on. It's certainly, I'm a chair of governors of primary school, it's certainly something that we've had as a massive issue, and that time outside of the support of high quality early years education for many of those young people has had a huge impact. And the challenge that we have, as you will know, is that there is windows of opportunity to really develop that and to address some of those early issues and identify where extra support's needed. And if schools aren't given adequate resource and support to do that, then the chances of being able to narrow those gaps later down are so much more greatly reduced. 2/3 of primary teachers and nearly half of secondary school teachers said that school closures had a negative impact on the spoken language development of disadvantaged students particularly, and we found that was a very different picture to those schools serving more advantaged students who said that they hadn't felt the same level of impact. So that gap that we talked about earlier growing even more, and you can understand that for some children having actually one-on-one attention at home potentially expose them to more opportunities for interaction in language, and for many of the young people who weren't able to have that, either their parents were working or they didn't have the ability to sit alongside them whilst they were learning at home, the level of language that they were exposed to had reduced significantly, and that's had an impact. And so 92% of teachers think as a result of that we've seen a widening in that gap in terms of language development. And for those children, young people who have specific language needs, 81% of them received less speech and language therapy during the first lockdown. So yeah, sorry, I'm getting told to wrap up, absolutely. So I think, you know, hopefully that's helped to frame some of the issues that we're facing. So there's absolutely a need to focus. There's a real challenge that's come up, particularly from the pandemic, but this has not been a challenge which is new to the pandemic. It's been something that has been an ongoing and persistent issue in our schools and for our children, particularly from those more disadvantaged backgrounds. This is an opportunity, I think, for us to do more, and hopefully to make that case even strongly. The evidence is stronger than ever before, and I'm delighted that Bradford, you know, is focusing on this so heavily, and look forward to working with you on doing more.
Thank you so much, Becky. I mean, oral language, spoken language is an underpinning skill, opens up the curriculum, and it's been pushed into deficit by the impact of the pandemic. This space here today is a space where we talk about things, but we also offer solutions, and we gather ourselves together to create solutions. One of the solutions that's offered up to Bradford is 50 things to do before you're 5, particularly in the early years, and we want to say just a couple of minutes on that today. Really excited that's an idea that was born in Bradford, and it's now reaching out and is an offer to over 500,000 children in England, and it continues to grow. Before we talk about 50 things for a couple of minutes, I'm going to hand over to my colleague at BHT to talk about an offer to support speech and language for our Bradford primary school. So I'm going to hand over to Rebecca now. Thank you.
Thanks, Christian. And that was great just to hear everything from Becky there, from Voice 21, everything I would be wanting to reiterate as well. If you can just move on, Christian, to ours. So we were approached by St Edmunds to do some work with them following the funding that they received through the Bradford Opportunity Areas. And two of the things that we wanted to offer as part of this funding that we already offer as part of BHT's language development offer to schools is our Fundamental Foundations programme that can be delivered within primary school settings, and one of our language development workers can go into school, and the offer that would be supported by this funding would be for half a day a week in school for one half term, as well as half a day a week dedicated to paperwork as well. And what that would provide your school or setting with is initial assessments of children, just to look at where the children are and gather a baseline on that, and then discussions with the class teacher to prioritise which children you'd want supporting on a one-to-one basis. And these children would have some tailored programmes written for them by the language development workers, and then that support would be delivered over a half term on a half-termly basis, but this funding is just for one half term. In addition to that, we offer narrative group work, so we can provide training to schools and for the language development workers to deliver a group within your school to 6 children for half a day, and then they would be also given information, weekly support to the teaching staff, conversations with parents, opportunities to feedback all the work that the language development workers are doing with the children on that one-to-one basis. And then the school will be provided with a written report at the end of that half term as well, just looking at what progress the children have made. Whilst the language development workers within the setting, they're there and able to model to practitioners, to the teaching staff, and then teaching staff can also access training that we deliver within our organisation. So the next slide, Christian, if you will. This one is just showing that we are offering, as part of this, some free training to schools. So although the Fundamental Foundations is heavily subsidised, it's not free, but this training is free. So we are wanting to deliver the I Can Early Talk training. So just going on some of the things that Becky said earlier, you know, why it's so important for our staff, teaching staff, anybody working within early years understand why communication and language development is so important. They would get that from this training course, and that would be free. So if anybody is interested in taking us up on the offer, they can contact me. I know my details are on one of the other slides, and we can arrange to come out and talk you through the fundamental foundation support, or if you're wanting to put yourself forward for the free ICANN training, then you're able to do that as well.
Okay, and I'm going to just hand over to my colleague, Rachel Dennis, who will just wrap things up with the final free offer to Bradford schools. Just a reminder of the 50 things to do before you're 5 offer that all Bradford primary schools can access. Rachel. Unmute, Rachel.
Hello, can you hear me now?
We can.
Great. So I'm Rachel Dennis. I'm the project officer for 50 Things to Do Before You're 5 in Bradford. I'm just going to take you through some of the current offer that we have for Bradford schools. We are fortunate to have been funded by the Bradford Opportunity Area and some funding from Jump, Join Us, Move, Play. So we currently have resources such as posters, card packs and banners that can help you to engage with your under 5. So that's in your nursery and your reception classes. We've been hosting since last year some virtual networking events for schools. So we're doing them quite informal, around half an hour on a lunchtime or half an hour just after school. And we're running them every month now for the rest of the term. We've got March the 24th, April the 26th, May the 25th, and June the 30th. And the hope is that in July, if we're able, we'll be able to do an in-person meet. And that just gives you a chance to share ideas with each other, to request resources if you need, but also to access CPD that we may have and to share ideas. We'll also planned some school enthusiast training, which will be happening on Friday the 1st of April this year. And that's if you have somebody within your school that you think would like to do a bit more in-depth learning on 50 Things to Do Before You're 5. We host, it's just a one-day session at St Edmunds, and we just take them through a bit what's behind it, and it helps to steer us where we'll be moving to in the future. We have a team of local enthusiasts that are based around the community, so that could be parents or early years workers that are enthusiastic about the project, and a lot of them have been with us since our launch almost 4 years ago, and they'll come out if you're planning a launch within your school and help to engage with parents, show them how to download apps. You'll also see them out and about at different events such as the Science Festival and school fairs and things like that once they're back up and running. We have another project called 50 Things at 2, which is aimed at engaging with children that would be eligible for a 2-year-old place at a nursery, but for whatever reason, they're not engaging with it or they're attending less than 50%. And it's not to replace that, it's just as an alternative if it's something they'd be interested in. And that involves 4 play in the home sessions. And we've also just adapted it so it can also involve 4 settings in a community hub as a smaller group. And that would only be a maximum of 4 people. And that's just looking at a way to connect people with their peers, but also things that are local to them. We're working with CAER to build some research around that also.
Wonderful. Thank you so much, Rachel, and a huge thanks to the sort of 50 Things Before 5 sort of team. It's just such a great example of what Christian said. We're identifying sort of our problems, but we're coming up with innovative solutions. We're making sure those solutions are evaluated, and then we're doing everything that we can to share that sort of a learning across the whole sort of country, and as we've talked about before, internationally. That's us bang on time now. I just want to say a massive thank you. 5:30. What a testament to the brilliant community that we've got here. The hard work is just beginning. I just can't thank everybody enough for the phenomenal work they've done over the last sort of 2 years, but also do exhort everybody to come together the special moment where we really start planning out for the next sort of 10 years, adopting these methodologies, and really enjoying the excitement of being at the sort of cutting edge of making substantial sort of changes that can change the world, that can really give every child and young person the very best possible start in life. So we're really looking forward to working with everybody. Massive thank you to everybody who's done such incredible work. Particularly want to say a huge thank you to Andy Daly-Smith, co-director of sort of CAER, to Christian for his phenomenal work in pulling all this together, for Lucy, for Kate. I could just go on and on. Thank you to everybody. Let's make this the start of something very, very special. We will be in contact. This is just the beginning of our sort of our journey, but it's a great start to that journey. So I wish everybody the best for this sort of evening, and a massive thank you again. And yeah, just looking forward to working with you this next year. Thank you. Bye-bye.